We think that kidney transplantation is a life-altering miracle. When we witness transplant failures due to non-adherence to medications, we can't understand why. We often ask ourselves, how can we better prepare patients for their new life? At least up to 1/2 of transplant recipients exhibit non-adherence to medications, and up to 1/3 of all solid organ rejections may be precipitated by non-adherence. And so we set out to try to help. In our center, we provide education to transplant candidates during the assessment process. However, once listed, a significant period of time may have passed prior to the patient actually receiving a kidney. Post-transplant, recipients are often overwhelmed and express surprise at the prospect of taking lifelong immunosuppression. Their quality of life outcomes do not always match up with their expectations. After informally polling our colleagues across the country, we see that our experience is not unique. We also realize that our anecdotal experiences are consistent with the literature.
We hypothesize that improving accessibility, repeatability, and ease of pre-transplant education may help to narrow the expectation gap experienced by patients. After reviewing the literature on transplant education and the feasibility of implementing an intervention into our program, we decided that video education was the way to go. Previous research suggests video-based interventions are effective and may even be superior to traditional methods of patient education. A video series for pre-transplant patients would allow information to be standardized and consistently delivered over a defined period of time without heavy burden on healthcare providers who are already overworked in most Canadian healthcare settings. It is widely accepted that repetition increases memory retention when the information is presented in spaced intervals and ongoing reinforcement is necessary. This is particularly important in the setting of solid organ transplantation, since patients must often wait more than 2 to 3 years before receiving their organ.
But what do patients need and want to know? To answer this, we undertook a needs assessment consisting of 3 studies gathering information on patients on the kidney transplant waitlist, post-transplant recipients, and the medical staff involved in the care of transplant recipients. We also investigated health literacy, patient satisfaction, and current gaps in transplant knowledge and beliefs about medications.
To accomplish the task, we assembled a multidisciplinary team consisting of pharmacists, nephrologists, and experts in adult education, behavior, motivation, and adherence. Each member plays a valuable role in ensuring the resulting videos are clinically accurate, effective, and appealing.